My name is Dr. Aaron Ward. I'm an imaging scientist with Lawson Health Research Institute at London Regional Cancer Program and an assistant professor of medical biophysics at Western University as well. The current procedure for prostate cancer diagnosis is by biopsy, where 6 to 12 small samples are taken from the prostate through a needle. The needle is guided to targets using ultrasound, which is great for being able to see the prostate and the surrounding structures nearby, to ensure that the biopsy needles take samples from within the prostate and don't injure sensitive areas that are nearby and within that region. However, the problem with ultrasound is that in most cases the prostate tumors themselves are not visible. So biopsy in general is guided using a one-size-fits-all template that's used for all patients. What this means is that sometimes needles can miss tumors, requiring the patient to come back for more than one biopsy session to get a correct diagnosis. When a patient does get a diagnosis of cancer, if the cancer is confined to the prostate, the mainstay of treatment is to treat the entire prostate gland. This can either be by surgery to remove the prostate or whole prostate radiation therapy. However, these treatments often have side effects that adversely affect quality of life, and although the treatments work, they are excessive for some patients. Prostate cancer varies a lot in terms of where the cancer may lie within the gland and how aggressive the cancer is. And for patients who have a relatively slower growing tumor that is confined to one part of the prostate, an emerging idea is to consider focal therapy to that tumor. This is kind of equivalent to the lumpectomy for breast cancer. The idea is to target only the region that has the cancer and leave the surrounding healthy tissue alone. This kind of treatment can have fewer side effects than whole gland treatment, and in fact there are many devices emerging now that can deliver this kind of treatment. We can use focal radiation therapy or focused ultrasound to target the tumors. There are focused thermal therapies that use a laser to destroy the tumors by heating, and focused cryotherapy that uses controlled freezing to destroy tumors. However, to use focal therapy, we need to be sure that the untreated part of the prostate is in fact clear of cancer. Prostate medical imaging is poised to revolutionize both prostate cancer diagnosis and therapy. You can see that in both contexts, we need to be able to see the target to be able to hit it. During diagnosis, if we could use a medical image like a magnetic resonance image or MRI to see the tumors within the prostate, we could aim biopsy needles at them and get the right diagnosis the first time. The same kind of imaging could be used to decide which patients would benefit from focal therapy and to properly direct that focal therapy to the tumor, sparing the surrounding healthy tissue. Prostate tumors are usually visible on MRI, but seeing them is a complex task for the physician. I like to think about this as being similar to learning how to fly a plane. It's also a complex task, and in bad weather you need to be able to fly by instruments without always being able to see directly out the window. So just like how a pilot spends many hours in a flight simulator learning and training to fly a plane, doctors can train within a simulator to learn how to target and destroy prostate tumors, learning to uncover the targets and aim their biopsy needles and focal therapy technologies. There are simulators for training doctors for other procedures, but there is no simulator currently for prostate tumor targeting. Over the past several years, our research team has been working hard to develop the necessary components to build the simulator. And we are extremely grateful to the London chapter of Motorcycle Ride for Dad for providing this key piece of funding that is allowing us to begin integrating these components to build this important piece of educational technology. Your support has allowed us to jumpstart this development and leverages our existing assets in a way that will translate to improved patient care. We anticipate that this will be useful not only to currently practicing physicians, but also to up-and-coming medical students in how to make the best use of emerging image-guided prostate biopsy and therapy technologies for the greatest benefit of their patients. Our activities have generated interest from prostate cancer physicians within Ontario and also internationally. We anticipate that the support from Ride for Dad will not only have impact on patients here in London, but also on patients around the world. So on behalf of our team, I want to thank the London chapter Motorcycle Ride for Dad very much for this extremely valuable support.